real heroes here are everyday New Yorkers who had to change their lives. All of you had to do something very, very different in very little time. A month ago, this city was in a very different reality. And a month ago feels like, a year ago now. I think a lot of us are having that kind of feeling that so much has happened so quickly. There's really nothing I can think of in our lives that has had this kind of reality where we've gone through just massive, massive changes in so little time. It seems like every day there's something very, very different, very new. Sometimes, hour by hour we saw huge changes. This is hard for all of us to make sense of. We're human beings. That's asking a lot of us to constantly adjust to such a difficult circumstance. And we as New Yorkers, we are warm people, we are emotional people. We love our family gatherings. We love our gatherings with our friends. We love to go to restaurants and nightclubs. We're probably the most social people in the whole country. We're used to being close together. And for these last weeks, that hasn't been possible, and that's really hurt. The fear about the disease, the anxiety, the pain we're seeing around us. Every New Yorker knows someone who has the coronavirus. So many of us know people who have passed away. That's what's in the front of our minds. And that's what we are every day fighting together. But at the same time, we all feel a sense of loss that we had a life that we in so many ways loved in this city. And it's been so strange and so different in the last few weeks. But I want people to know, the reason I say the heroes are everyday New Yorkers is because when asked to do something incredibly difficult, when asked to make these massive changes, New Yorkers went and did it. Amazing levels of follow-through, compliance with these instructions, no matter how hard it was. And it's something everyone should be proud of, because even though we got a long way to go, this is still going to be a very long battle. What we've seen these last few days really proves that social distancing, shelter in place, these are ideas that make a huge difference. And they only make a huge difference when people do them the right way, and New Yorkers are doing that in so many ways. So this gives me hope, more hope than ever, that we can get through this really tough moment and come out together, save a lot of lives, and get on to recovery at some point. But now here's the point I want to make about not drawing too many conclusions, because again, there's a danger in that. We're proving every day that these smart strategies can save lives, can protect people. But we know from some other parts of the world that they started to see a little bit of progress, took their foot off the gas, let down their guard, and guess what? This awful, ferocious disease started to reassert itself. And that's something we have to guard against. We have to beat it back, not open the door again too early for it to resurge and hurt so many people. So what I'm telling you today is something has started to move. We're going to let you know day by day if we see that that positive pattern is sustained or not, because there's no guarantees. Clearly tells us something about what has been working, but it doesn't tell us when this is going to be over. It tells us we got to actually double down and stick to the strategies that are working. And that is frustrating. I'm trying to tell you the truth based on all the information we have, but it's frustrating because we all want to get back to normal. We all want to go see our family, our friends. The weather's getting nice. Everyone would love to go out, be in the park, eat outdoors at a restaurant. There's all sorts of wonderful things in this city. Outdoor concerts, all the things that we look forward to as it gets warmer. But we're not there yet. And we can't get our hopes up the wrong way. We have to keep vigilant, disciplined, strong, resilient. This is what New Yorkers have done. And this is what we've done in other crises too, and we need to keep doing it. So the point about doubling down is if the strategy is working, stick to it. Even as it gets warmer, you start to feel that pull, like you want to go do some of the things you used to do. Stick to the plan, stick to the strategy. Over time, we'll be able to give you more a sense of how long this will be. I've always said, expect a tough April and a tough May. I'm still saying that. But what we'll do is with every piece of new information, we'll update you, give you a sense of what it means. But in the meantime, see the progress as an affirmation that you have done the right thing. And if you keep doing it, it's going to help us through this. Why are we telling you there's some progress? Well, this is about the facts. First of all, the ventilator use. We've talked so much about ventilators. They are life-saving. This is the way you ensure that someone, God forbid, they're in distress. This disease is close to taking their life, and a ventilator can save their life, help them keep breathing, help the doctors and nurses see them through. The question until very, very recently, just a few days ago, was would we have enough? And that was based on the fact that we saw some very clear patterns in the use of ventilators. And in the last few days, we've actually seen fewer ventilators needed than were projected. And that's very, very important. We expected a really deep intensification of this struggle. We expected the number of ventilators to keep being needed to be more and more going into this week. We've seen actually much fewer needed than we expected. Now, to be clear, we still need more. Meaning that there's still each day more people who need them, but much less than expected. That's a good sign. The hospitalizations have stabilized. For a long time, that just kept going up and up. We're now seeing some leveling off, again, based on only a few days, but something good on that front, too, that's telling us something positive. And I want to be clear. We know that means we're not out of the woods. It's too early. It's too preliminary. But we'll keep telling you each day what the evidence is saying. So far, so good, but a long way to go. Now, the ventilators. So I want to just recap to you what was going on as recently as Sunday. I said then based on all the estimates we could put together, we talked to all the hospitals and looked at every pattern, all the facts, that at that point there were about 4,000 New Yorkers who needed to be intubated, who needed a ventilator to keep alive. And as recently as Sunday, we expected the number of new ventilators we were going to need each day to be 200 to 300, maybe even more. But what's happened in the last couple of days is that number has come down. And it looks like that number is more like 100 or even less in terms of the number of ventilators we'll need new each day. That's a striking difference. It's very early, it's very preliminary, but that is a striking difference. We thought we would need many more ventilators to come in this week just to get through the week. As recently as Sunday, I told you that we needed 1,000 to 1,500. A few days earlier, I told you we needed something more like 2,500 to 3,000. That's how different things have been day to day. We thought we'd need a huge number of ventilators just to keep the hospital system running, just to save the lives that could be saved. That number went down, and it's gone down again. Still a long way to go, but that is striking. Now, constantly over these last few weeks, I've appealed to the federal government, the state government to help us with ventilators. I want to be thankful, and I want to be clear that our call for help has been heard time and time again. So we got constantly shipment after shipment, including most recently 500 more ventilators from the state of New York. This now means we have a total of almost 5,500 ventilators available throughout our New York City hospitals of all kinds. We have a small emergency reserve of 135 that we're holding in case something has to be quickly moved to a place where the need is greatest. What it means for the first time in a while is that I can say with assurance that we will get through this week in terms of ventilators. We actually have enough to get through this week free and clear. We are not going to say that we can accurately predict next week yet. It's still too early this week to say that. But the fact that we have confidence we can get through this week is definitely a good sign. Now, there's some other things to report, and some of them are hopeful, and then some of them are very, very tough and raise very important questions about what's really going on. But one that's good is when it comes to our public servants, our first responders, the people who we depend on to keep us safe. So many of them we know were out sick because of symptoms of the coronavirus or because they had a confirmed case of the coronavirus. And that has been something that caused tremendous worry. We were worried for them. They're our heroes. We wanted to make sure they came through okay, their families came through okay. But we also saw fewer and fewer of our first responders available on any given day, and people got very worried about what that would mean. I want to thank the NYPD and the FDNY for holding the line throughout this crisis, always coming up with another way to address all the challenges out there to make sure that the men and women we relied on were ready, always bringing in new first responders. Of course, the amazing effort to bring in paramedics and EMTs from other parts of the country. We're so thankful for that. But here now we're seeing something good start to happen, because I've said all along, one thing that's true about our first responders is primarily they are younger and obviously very healthy people, and that meant that they could go through this disease quickly, thank God, in the vast majority of cases. And I'm not for a moment forgetting we have lost some of our first responders. Their families are grieving. But thank God for the vast majority. They've come through quickly and they've come through well. So the NYPD now reports that they have 276 officers who had tested positive who have now returned to duty. The FDNY reports that 1,310 EMTs, paramedics, and firefighters who either tested positive or were exposed to a patient who had tested positive or were suspected of having been infected. 1,310 of our first responders at the FDNY have returned to duty. And that's so moving. That's so important for all of us. So we're very grateful. But I told you there's also some things we're learning that really should cause real concern, and facts that now are clear. And we want to make it very clear to the people of this city that as facts become clear, we're going to put them out. We're always going to make sure that we believe the information is accurate. But once it's factual, once it's clear, we're putting it out. So one of the things that's been discussed in recent days is, what do we know about who is being afflicted by this disease? Who are we losing? What does it tell us? Are there some larger realities that we need to look at here? The answer is yes, there are. Here is a disease that has hurt people, hurt families in every corner of our city. Let's be clear. Every community, every zip code has been hurt by this disease. Families are grieving right now across every part of the 5 boroughs. But we also now have information that points out that there are clear inequalities, clear disparities in how this disease is affecting the people of our city. The truth is that in so many ways, the negative effects of coronavirus, the pain it's causing, the death it's causing, tracks with other profound healthcare disparities that we have seen for years and decades in this city. So many people have struggled to get the health care they need, who didn't have the money to afford the health care they deserve. So many people have lived with chronic health care conditions throughout their life, so often associated with challenges like poverty. We're seeing folks who have struggled before really being hit particularly hard by the coronavirus. Look, that's a blatant inequality, and we don't accept it, meaning we have to fight in new ways. We have to come up with new strategies to address what is now a documented disparity. As you're going to see, again, every community feeling this pain, some communities feeling it disproportionately. We're going to help everyone. And the strategies we have in place are meant, of course, to save the lives of New Yorkers across the board, every part of our city. But we're going to double down on the strategies that reach people who are the most vulnerable now, because we're seeing these very troubling facts. So here's what the information from our health department shows us. And this is preliminary information, but it is based on specific records, meaning, and this is a tough thing to say, but I want to make sure people understand the facts. This is based on death certificates. This is based on the work of our medical examiner's office and our Department of Health confirming that someone has died of a COVID-19 related illness, and that their specific background is documented. So what we've learned is that the deaths because of COVID-19 in this city, first and foremost, have affected the Hispanic community with 34% of the deaths. That community is about 29% of all New Yorkers in terms of population, but 34% of the deaths. And again, this is preliminary information that we'll keep adding to. It's hard to talk about this stuff like statistics. This means human beings, this means families, but we have to look in the face these disparities that we're learning about. So the Hispanic community, 34%. The Black community, 28% of the deaths, compared to about 22% of the overall population. The white community, 27% of the deaths, compared to about 32% of the overall population. The Asian community, 7% of the deaths, compared to about 14% of the overall population. This is painful to talk about, but we have to be honest about it. There's a lot more information that will keep coming out. As we have information, we can verify. We will keep making it public. But it already tells us something we need to know, and it tells us that we need to act. So now I want to talk about the plan that we will put in place immediately to address this information we now have about disparities. First, the first and most important element of the plan is to focus on our public hospitals in particular, and some other hospitals, some of our independent hospitals certainly as well, but first and foremost, our public hospitals. Because this is about the most essential concept of ensuring that everyone gets health care, regardless of their background, regardless of their zip code, regardless of their income. That has been the entire idea of our extraordinary public hospital system from the very beginning. We have the biggest, best public hospital system in America. It was always built on that New York belief in fairness and equality. We need to double down on that now. We need to ensure that our public hospitals get absolutely everything they need, because we know that so many New Yorkers who are in the most vulnerable communities, in the most danger, where do they turn to? They turn to our public hospitals. The most obvious example has been Elmhurst Hospital in Queens. We've all seen what's played out there. And the doctors, the nurses, all the healthcare workers, they have been the most amazing heroes, because whatever was thrown at them at Elmhurst, they held. They kept that hospital going. They handled an extraordinary number of cases. They kept saving lives. The public hospitals are the greatest guarantee we have that there will be fairness and equality in saving lives. And that's the single most important thing, because we know, the blunt truth is we know a huge percentage of New Yorkers, no matter what strategy is put in place, this disease is here. It's going to reach a huge percentage of us, most likely over half and even more. So people are going to have to confront this disease. It's painful, it's awful that that's the truth, but that's the truth. But when they need urgent health care, when they need to have the best doctors and nurses there to save their lives, for so many people that means going to their local public hospital. And we must ensure that that hospital has all the personnel it needs, all the ventilators it needs, all the PPEs, everything. That's been the core of the strategy, and we got to go even deeper into that strategy, because that's where you literally save the lives that can be saved. The second is we're going to do a major campaign to educate people, to give them more and more detailed information on how to address this crisis. There'll be a multi-million-dollar ad campaign, a traditional media, digital campaign, focused on communities of color, focused on communities where English is not the first language. In fact, these ads will be in 14 different languages with a deep effort to get to folks who have gotten some of the word, obviously, but not all the information we want them to have so that we can further protect them. We're going to keep investing in this kind of effort to make sure we get much deeper into communities, including immigrant communities, with real valuable information about how to navigate this extraordinary challenge. Third, the media efforts, everything we're trying to do to educate people every day are crucial, but they certainly will not be enough. And now comes a part that's going to be very challenging because of the nature of this crisis, but we have to do grassroots outreach again. This is something we're going to develop over the next few days. We're going to have to work closely with community-based clinics where there are healthcare workers that have a deep sense of their own communities, who speak the language in every sense of their own communities, who have the relationships and the trust. We're going to have to find a way to get healthcare workers out into communities to educate people, to answer their questions, to help them address their immediate challenges, but in a way that's safe for those healthcare workers. We are absolutely, as you heard earlier, sticking by shelter in place, social distancing, but we need to find a way to get healthcare workers in a safe, smart, strategic way out into communities for direct communication with people in greatest need. So we'll have more on that plan in the coming days. Clearly, those healthcare workers will need to have proper protection, and that has to be absolutely secured for this plan to work, which is why we will continue all our efforts to bring in a huge amount of additional supplies to the city, PPEs, to protect all our healthcare workers and first responders and everyone who needs them. Fourth point is to deepen our efforts that have started, but I think they can go a lot farther. When you call 311, for example, there are many times when you're patched through to a health and hospitals clinician, a doctor or a nurse or another healthcare worker, who can answer questions and determine, for example, a lot of people call wondering if, because of how they're feeling, if they need testing. That's been something that people have been able to get through 311. But we need to deepen that and make it more possible for people to call just to talk through their situation more, to get more advice, and not just because they're wondering whether they need a test, but to actually have a dialogue with healthcare workers, again, in multiple languages, about what they're feeling, what's going on. Maybe it is not someone even just calling about their own condition. Maybe it's someone calling about their grandma, their grandpa. Maybe it's someone calling about their mom or their child. We need to create more of an opportunity for everyday New Yorkers, who many of whom don't have a doctor that's their everyday doctor, to get someone on the phone right away, a trained professional who can talk through the details and give them guidance. That has to be much more available, and that's what we're going to do. Now, to ensure that we protect that first key part of this plan, our public hospitals, we just need more help, particularly when it comes to personnel. The frontline healthcare workers have gone through hell, but they've held the line. They've been heroes in every way. Some of them have gotten sick themselves and been out. We look forward to them coming back healthy. We're praying for them, we're hoping for them, and for their families. But in the meantime, the many, many healthcare workers who are continuing to fight this fight, they have really borne the brunt, and they're tired, and they need relief, and they need support, which is why I've repeatedly asked for military medical personnel. And it's been a plea I've made to Washington repeatedly. We've seen some progress. We have almost 300 who have come in now out in our public hospitals. These are doctors, nurses, respiratory therapists, highly trained people, highly effective medical personnel, many of them with the kind of military experience that makes them very, very ready to handle the toughest situations. Almost 300 of them now. deployed out in our health and hospitals, public hospitals. The Navy has sent healthcare professionals to Elmhurst, Bellevue, Woodhull, and Kings County hospitals. The Air Force has sent healthcare professionals to Lincoln, Jacoby, and Queens Hospital. I'm very grateful that our armed forces have come forward to help our public hospitals, but we will need more help, and we need it quickly. Now, let me talk to you about building out even more healthcare capacity for people who need it. And this is another area where there's some real progress, and we got to make sure we keep building. We're still working always from the worst case scenario to make sure that whatever happens with this disease, New York City is ready. So one of the crucial things, again, adding additional beds to relieve some of the pressure on our core hospitals. Last week, about 8 days ago, I was at the Billie Jean King Tennis Center in Queens. What you looked at then, it was a bunch of tennis courts, indoor tennis courts. Now, right now, it is being converted into a hospital facility. We'll start receiving patients this week. We will convert 20 beds in the new facility to ICU care. And the total number originally was going to be 350 beds, will now be 470 beds. So this is a case of continuing to go faster, add more to make sure we can serve people in need exactly when they need it. On the personal protective equipment, a lot of us didn't really use the phrase PPE before a few weeks ago, and now it's something we talk about all the time. We've gotten a lot more in to protect our first responders, to protect our healthcare workers. And yesterday we made a delivery out to the hospitals of this city. Over 3 million surgical masks, over 2 million surgical gloves, almost 1.2 million N95 masks, over 100,000 pairs of eyewear, protective eyewear, 61,000 surgical gowns. It's very important that this material has come in and gone instantly out to the places that need it. And we're working hard every day to make sure each and every hospital gets what they need, distributes it effectively, constantly gets resupplied when they need it. But we have one urgent need, and that is these surgical gowns. I was at the Brooklyn Navy Yard yesterday talking about an amazing homegrown effort to produce them here in our city, a really heroic effort by companies in the Navy Yard and the folks who work there to protect all of our heroes. They're creating a lot of surgical gowns, but this is an area where we need a huge new supply. So we have asked the federal government for over 9 million surgical gowns to get us through April and into May. We are hopeful that we'll start to get deliveries from that request quickly. We need them even to get through this week. We need more. And we're going to have fallback options in place to make sure we can protect people this week. So the final thing I want to do is talk about some of the people who are stepping up. And even amidst the challenges, we see nonstop, everyday New Yorkers helping each other, people feeding our healthcare workers, our first responders, businesses stepping up, amazing efforts. I want to keep talking about them because it's something people should be really proud of, and it's something that's helping to sustain us. And one that's very special I want to talk about today, because it's from a foundation that was born out of our city's darkest hour, and it's a foundation that means so much to us all. The Tunnel to Towers Foundation, born out of 9/11, symbolic of the strength and resiliency of our city. Tunnel to Towers has done so much for so many people, always there for our first responders and their families, now stepping up again. We've just heard of a $3 million pledge by Tunnel to Towers to help our healthcare workers. And I'm so appreciative, yet another heroic action by that amazing foundation. Also, crucially, Senator Schumer has unveiled something important, the COVID-19 Heroes Fund. And this is an idea that would give the essential workers additional pay, up to $25,000 and would give a one-time $15,000 payment to healthcare workers, home care workers, first responders. This is an idea that needs to be made real to help those who are suffering the most. Keep reminding people, the federal government, we did see some progress in that last stimulus bill. We need a lot more. Spoke to Senator Schumer this morning about the next stimulus bill. I know he is proposing, to his credit, I know Speaker Pelosi is leading the way as well, that in the next stimulus, there'll be money for our hospitals, there'll be money for food banks, money to support small businesses, not big corporations, small everyday businesses, and money to help localities and states that have borne the brunt. Obviously, that means all of us here in New York and New Jersey especially. Crucially, Senator Schumer, Speaker Pelosi are focused on ensuring that all the cities and states that have lost not only lives, but they've lost so much of the resources to save more lives and protect people and recover, that those resources would be restored through a fourth stimulus bill, hopefully as early as this month. So I want to thank Senator Schumer and Speaker Pelosi for their leadership. Now we need to get the Congress to come back and pass that bill so we can still fight this battle and win this battle and then start on the road to recovery. Look, I'll finish just affirming the point that we all need hope. We all need hope, and when we see good news, when we see something that's working, we need to talk about it, we need to feel good, and we need to especially feel good that everyday New Yorkers built this progress with their hard work, with their sacrifice. Every one of you, when you're hearing today that we see some progress, you should feel that was because of you, because it was. At the same time, recognize we're not out of the woods. It'll be a long time before we're out of the woods. We've got a strategy that's working. Let's go deeper into it. Let's double down so we can get through this together. I am confident, really confident, always felt in my heart that New Yorkers would rise to this occasion, and you have. You have in a remarkable way. Let's finish the job. It's not going to be days. It's going to be weeks and months, but let's finish the job. Just a few words in Spanish, and then we'll take questions from our colleagues in the media. Es temprano para sacar conclusiones completas, pero los nuevos datos nos dan esperanza en nuestra lucha contra el coronavirus. Sé que todos los neoyorquinos queremos que esto se termine, pero no podemos bajar la guardia. La distancia social y quedarse en casa está salvando vidas. Y tenemos que seguir aún más para salvar a más neoyorquinos. With that, let's turn to questions from the media, and please let me know.
And First Deputy Commissioner Torres Springer. And with that, we have Shant from the Daily News up first. Shant?
Yeah, thank you, Mayor. Just wanted to get a little more info about the very troubling data about communities of color from you and Dr. Katz and Dr. Barbeau. Can you say what the understanding is now for the cause of this disparity?
I'll start with a very basic point and then turn to both doctors. You know, in the beginning of this crisis, we all were rushing to set up the ability to handle a huge number of cases. One thing we knew from the beginning, and we saw it around the world, is that this is a disease that could escalate quickly, so we were securing the ability of our hospitals to fight this battle. But then as we got more and more information, and you saw the map a few days ago, and that was striking, and this new information is striking, it became clear that these disparities were real and sharp and needed to be talked about and needed to be acted on. One thing I think is clear, I've talked this through with our healthcare leaders, is that people who have had less healthcare available to them are more vulnerable. If throughout your life you haven't gotten the care you deserved, or if you've had pre-existing conditions that weren't addressed the way they could have if you had had more resources. Because again, healthcare still in this country is based on how much money you have. And in this city, all of us have tried to change that in some very real ways. But there's still a reality that folks with more resources get more health care. So I would say the first thing to know is that, there are a lot of people, particularly seniors, in communities of color that were more vulnerable because their conditions had not been treated the way they could have and should have if the resources had been given to them that they deserved. Dr. Barbeau?
So I'll add to what the mayor just laid out, which is something that I agree with. I think it's important for us to note that where we are seeing these inequities are places and populations that have historically had higher rates of underlying chronic illnesses. And certainly those chronic underlying illnesses put these individuals at greater risk for poorer health outcomes. The other thing that I will say, and I think that we are still really digging into this, is I am very concerned when I see the large percentage of Latinos who have died of this illness. And even though we have made lots of efforts to reassure people that all of our public hospitals see individuals independent of their immigration status, independent of insurance status, that the overlay of the anti-immigrant rhetoric across this country, I think, has real implications in the health of our community. And certainly concerns about public charge are some things that I think we need to dig deeper into it. Commissioner Mostofi and I have spoken out about the importance of suspending public charge during this time. And I think, it's something that, again, we will be digging into deeper to better understand. But the overall, concerning aspect of this is the fact that these are communities that have had higher rates of underlying chronic illness, and that it's a reminder that these chronic underlying illnesses in peacetime, as the mayor has spoken about, contribute to higher rates of premature mortality from those chronic illnesses, but that in this particular wartime scenario are really very concerning for higher rates of mortality.
Dr. Katz, do you want to add?
I would just add to what the two of you have so smartly said, that lower income people also live more likely in multi-generational housing because of the high cost of apartment rentals in New York City. And so multiple families may be living together in very small spaces, which I think facilitates the transmission of this virus.
Yeah, and to finish, Sean, look, I got to tell you, when I saw this, it made me very angry. I want to be clear. We're all trying to fight this battle and keep focused and keep, calm in the midst of a battle that we must win. And as leaders, we have to stay calm. But it made me angry to see that the disparities that have plagued this city, this nation, that are all about fundamental inequality, are once again causing such pain and causing innocent people, to lose their lives. It's just abundantly clear. It's sick. It's troubling. It's wrong. And we're going to fight back with everything we got. And right now, all we have to think about is saving the next life and getting through this crisis. But someday there's going to be a reckoning about what all this taught us. That obviously our nation was not in so many ways prepared, but more importantly even than that, I would say literally more importantly than that our nation has still not come to grips with the fact that healthcare is provided so unevenly and all based on how much money you have. And until we get to some form of universal health care, until that's the reality, this kind of danger will exist, not just when there's a pandemic, obviously in people's everyday lives. But you know what? We should be worried about the future. This is not the last time we're going to see a new disease. Here's a disease we never even heard of. It literally didn't exist 6 months ago, and now it's ravaging us. If we're really going to prepare for the future, we better recognize that if we don't create equality and fairness in healthcare, there's going to be people vulnerable always who didn't need to be.
Kathleen from Patch is up next. Kathleen?
Hi, Mr. Mayor. Can you hear me?
Yes.
Wonderful. I was hoping that we could talk for a moment about food disparity or food accessibility. You've said yourself that more than half of a million New York City dwellers have lost their paycheck. NYPD data is showing that half of the thousands of supermarkets they're visiting are closed. Are you worried that New Yorkers aren't going to be able to access food? Is that something that your office is working to fix, and what would the potential solutions be?
Kathleen, I really appreciate the question. I'm very, very worried. I want to make this crystal clear. When I announced a few weeks ago that Catherine Garcia would be our food czar, it was explicitly because I saw a gathering storm, that with so many people losing their income, in the first weeks, you could presume people might be able to get by. But with each passing week, it's getting harder and harder. And yes, I'm glad there was that money in the stimulus to help people directly, but it's not that much money in the scheme of things, and it's not in people's pockets yet. So I'm very worried. When you're not talking about a few thousand people, you're talking about 500,000 people who lost their job. And very soon, that is going to mean more and more people who cannot find a way to pay for the food they need. So I think you make a really good point that if supermarkets are shut down, thank God there are a lot still going, and I want to thank the supermarket workers, the grocery workers. These are folks who are doing something really heroic too, and we got to thank them. Thank the pharmacy workers, all the people out there making sure that the basics are available for people who have enough money to pay for it. Thank God those workers are there making sure that people get what they need. But I'm worried about more and more people literally not having any money at all to pay for food. The plan that Commissioner Garcia is putting together is for a large-scale feeding effort, a large-scale effort to feed hungry New Yorkers, such as we've never seen before. I hope that when it comes down to it, it won't be as bad as we fear, but we are preparing for a very large-scale effort. That will be a priority in everything we do, where we put our resources, where we put our energy, our focus. Making sure people have food is going to be a central priority. We haven't felt the fullness of the danger and the need yet, but I unfortunately believe it is coming. So that means the initial efforts, we're doing expanded home delivery of food to seniors and vulnerable folks who can't get out of their houses. Anyone can call 311 and sign up for that, who is one of the folks who is vulnerable. They can get that. We announced last week that we are now at 435 sites. Schools that were previously just providing food for kids are now providing food for any and all adults who need it. So I just want to make this crystal clear. I was at PS1 in the Lower East Side yesterday. Any adult in New York City can go to one of these 435 sites and get 3 meals for yourself and as many family members as you have. You can ask for it. If you have a household of 5, you can say, I need breakfast, lunch, and dinner for 5 people, and they will give it to you. It's going to be available all 435 sites. It's high-quality food. I saw it yesterday with my own eyes. I saw the food service workers who are also doing valiant work. They want to make sure people are not only fed, but as quality, nutritious food. So they're out there doing that. You can call 311. You can go to nyc.gov to find those locations. So that's going to be crucial, a part of the equation. But I think we're going to even have to go farther than that. We're definitely going to be supporting, in a variety of ways, local food banks, food pantries, to keep them going, and then just keep building from there. My order to Commissioner Garcia is whatever it takes to feed New Yorkers, whatever the expense, whatever the effort, no matter how many city workers it takes, no matter how many volunteers it takes, we're going to do it.
Julia from the New York Post is up next. Julia?
Julia?
Julia, can you hear us?
Hi, Mr. Mayor. How are you?
Good. How you doing? Julia?
Julia, we can't hear you.
You're going to come back?
Yeah, we'll come back to
Okay.
her. Yoav from the city is up next. Yoav?
Hi, Mr. Mayor. I wanted to ask, you've made it clear beforehand when we've asked about the racial and ethnic data that providing the data was of secondary concern to saving lives. But here, in response to producing the data, it's clear that the city is taking steps that are intended to save lives. So why weren't you able to do that beforehand? Because clearly the data is important in determining how the city responds. So why was it secondary? Why was it secondary in nature? You've always said you can walk and chew gum at the same time. Why wasn't that possible here?
Because we're all walking and chewing gum on many, many levels. This is nonstop crisis, and everyone on the phone with me here and all my colleagues are working nonstop. The concern, and Dr. Barbeau can speak to it, is the health department was very concerned that there be something verifiable, that you have to make sure there was enough evidence, that it was confirmed, that we not put out something that was unclear or not based on enough data. So that is absolutely crucial. If we're going to tell people something, we better damn well be right about it. Also, as I said, what's happened out there, there is more data we'd like to be able to provide, and some of it is been hard to get as clear as we'd like, because in a crisis atmosphere, I assure you that folks at the front line are not focusing on, recording data when they're trying to save lives. So there's been real crisis dynamics that have mitigated against getting the kind of data we would in peacetime. And then there's been real concern to make sure that what we had was accurate and consistent and enough evidence over what's really been just weeks. Now that we believe it, that we really have something hard and fast, it's telling us what we got to do. But as I said in the beginning, the one thing that was unquestionably job one and remains job one for folks experiencing the disparity and everyone is to protect the hospital system. That's where the overwhelming majority of our efforts were going, to protect and build up our hospital system. And that was more important than anything, because that's what every New Yorker needs. Dr. Barbeau?
So to build on what the mayor laid out, I think, we've been focused on having complete data. And I've spoken before about the fact that our reporting is only as good as the quality of the data that we get in. And it's been a challenge to work with hospitals who are overwhelmed with patients in the intensive care unit, on the floors, in the emergency department, to focus on the more granular importance of data. And as I've said in the past as well, we've then resorted to alternative data sets in order to augment the data that we have, meaning that, we're going directly into electronic health records at hospital systems, because we recognize that, as the mayor laid out, these folks are overwhelmed with taking care of patients, but it doesn't take away from the importance of needing to know this information. And so the other thing that I will say is that, in spite of all of those efforts that we've made to have complete data, the percentage of reports that we have in terms of race related to people who have died from COVID-19 is slightly less than 2/3. So we're still dealing with incomplete data. But I think it's important to note that we are, as the mayor likes to say, not making perfect be the enemy of good. And so we are not waiting until we have 100%. We are acting now. There are other aspects of our data that we are also looking to improve the racial demographics of, but again, it is an ongoing effort in collaboration with the state as well as with our healthcare partners.
Back to Julia. Julia?
Hi, can you hear me, Mr. Mayor?
Yes, Julia.
Hi. So I found the numbers you gave on the ventilators very interesting. That we were projecting we need 300 more, but we're only needing about 100 more. Could you give us kind of similar numbers to show how hospitalizations are, either leveling off or down? And then I'm just wondering if you could follow up on what you said on TV this morning, that you think that the statistics for folks dying at home, which are overwhelmingly being driven by coronavirus, should be included in the official death toll. Do you expect that to happen soon?
So on that one, look, it's a very, very painful reality. I just want to say, imagine what a family goes through, struggling to help a loved one, and obviously hoping and praying that something will pass, and then suddenly someone's gone. It's just horrendous. But the numbers speak for themselves. I've been over this with our health colleagues, that this used to be a very, very rare thing in New York City. And suddenly it's jumped up. And obviously, the only thing that's changed is COVID-19. So the health department knows what they're doing, but what I would say as a layman is, let's just assume that with this kind of increase, the vast majority of these are related to COVID-19, directly, indirectly, and start counting them. And I'm sure the health department, can figure out what's the right way to do that. But I think it would be more accurate to just acknowledge what is, to me, a growing truth. On the question of the hospitals, I'm saying stabilization because I think it's fair to say that the hospital admissions numbers and people going in and out of ICU, there's still a lot of variability there, meaning we get data. But again, what we're finding from a lot of hospitals is there's a lag in their data because they are first and foremost focused on saving lives. And the data is a little bit uneven for that reason. Also, the improvement we've seen is only over a few days. So I think the word stabilization is right to say that for a period of time, we were seeing a constant increase. We're not seeing that now. I'm not clear yet if we're in the territory of any kind of sustained reduction. The ventilator piece is actually, in some ways, much clearer because it's a real finite number. It is specifically about people who are intubated, people in those ICUs. We can literally know how many ventilators are out there, and we can get very quickly updated on how many are in use. So that one, where we thought it would be 300 more each day, and it's looking like 100 more each day or less, that's striking because that moved rapidly in a matter of days. Again, I want to see a lot more days and weeks before we draw any firmer conclusions.
Dave Evans from ABC7 is up next. Dave?
Hey, Mayor, this is Dave Evans. Can you hear me okay?
Yes, Dave.
Hey, I just had a question about antibody testing. And I know it's a state function, but I wanted to ask you because we are the epicenter of this crisis. And the governor talked about it yesterday. Dr. Birx talked about it this morning. And they call it a game changer. I just wanted to see if you see it the same way. And my other question about this is, since we are the epicenter, has the FDA, the CDC, has anyone in the federal government contacted the city to see if we can start moving in that direction? How in the world are we going to do all these tests? And do you see it as a possible game changer?
Yeah, it's a great question, Dave. I'll start, and Mitch, who's obviously thinking about this from the perspective of the frontline hospitals and their heroic employees, and of course, Oxira is thinking about this in terms of the whole city. They'll join in. So I think it's a big deal. I think that the first thing that I understand about the antibody testing is it's not here yet in the kind of numbers we would ideally want. So I want people to understand that with everything with testing, and testing has been sort of the big problem, the big X factor through this whole crisis. is anytime people are wishing for testing, the most important thing to understand is, does it actually exist in the numbers we need it to or not? Right now, the answer is no for antibody testing. But at some point, and that might be, in weeks, that might be in a month or two, you could have antibody testing available on a much bigger level. I think it would be very, very helpful because to begin with, it would help to strengthen the folks who are doing all this heroic work in the hospitals and the first responders if they knew for a fact they were exposed to this disease. And, we all presume that means some immunity. It's not a perfect equation, Dave. I'm sure the doctors are going to say this, that there's no one who knows the answer yet on this question because there's still so much about the coronavirus that there's no one on earth has definitive answers on. We don't know for sure that if you've been exposed to it, it means you cannot get it again. It seems likely that if you've been exposed to it, you wouldn't get it again this year, this season. But we don't know that 110%. But we know enough to say it would sure as hell be helpful if people knew. It would give them a lot more confidence and would tell us a lot. So I'm hoping that's something that could be a big part of the strategy when it's really available on a broad level. I think the bigger point about testing is what we should have had in the beginning was universal testing. It's one of the really crucial strategies we've seen that has worked in the world. It clearly was something the federal government did not have ready, did not provide. Somewhere in the future, universal testing could be part of the way out of this crisis, but it's still clearly, again, the numbers aren't there yet, and they won't be there for a while. But that's something we should be focused on as one of the potential ways to recovery. Mitch, you want to start with anything you want to add?
I think you've gotten all the big points. I know, Mr. Mayor, that you yourself spoke with the head of the FDA, Dr. Hahn, about having enough access